see all the participants. We got 73 so far. I imagine some more will be coming on and joining us. We got, like Barry was saying, a packed agenda today, which I'm always excited about. So we're just going to I know the agenda that was sent out earlier of some topics, but we're going to kind of move those around as availability changes and everything like that. So again, my name is Robert. I'm one of the leadership members. One of my roles is chair of the coalition and also sit on the board to represent the coalition at the Continuum of Care Board meetings. So I do my best to represent us there as well. We will be going over some information today that is very helpful. But first, I want to go over kind of the purpose and mission of the Spokane Homeless Coalition. We are definitely into planning, education, communication, advocacy, and do our best to provide that out to everyone who's online here or anyone who wants to access our website. All these meetings are recorded. And then if you want to participate in the Homeless Coalition webpage or email chain that circulates, you get updates on community resources that come available or changes in organizational settings and changes in their systems. So it's always good I know it's a lot of emails that come through there, but you can definitely glean out some helpful stuff. Want to go over some virtual etiquette. So please, everyone, if your microphones are not muted, please put them on mute and address any questions that you have in the chat box. Barry will do his best to remind me as well as if questions come up. I'll be looking at that as we have presenters each month talk about a specific subject. Also with the Google Groups, if you are a part of that email chain, this is a forum to dispense information, encourage and not criticize each other. And it's not to be used as kind of like a social media platform. We have enough of those platforms already that if you want to engage in those, I'm sure you can find a different one to do so. So typically with these coalitions, I know I'm kind of moving pretty fast here, but like I said, we have a bunch of stuff to go over. But typically we like to take time to reflect on collaboration. And then also I provide a little reflection sometimes too. But today we are skipping all of that because of how much we get to go over today. So I'm excited about that. A few updates. One is, let's see, so a few things. Walmart is doing like this hiring situation this week. I know this is kind of a random tangent, but I've helped a few people now fill out applications for Walmart, and they're having a hiring fair out at Airway Heights. So if someone is looking for employment opportunities, that is going to be happening this Saturday. They prefer that you fill out the application online before going to that fair in Airway Heights. But there are a ton of positions open. So if you know anyone that's interested in that, please, I think the flyer came out through the email chain a couple weeks ago. So just kind of go through those. I'm now putting in the chat box as well. Tim, the community housing and homeless services with the city, emailed us and provided us with some information in regards to changes in birth certificates. I know a lot of you ask me about birth certificate vouchers, which are coming soon. Hopefully, we'll keep you posted on the email chain when that comes through. But this is a link that I put in the chat box to kind of changes. The fee is now $25, but there's no fee in specific circumstances. And those specific circumstances are in that link I just shared in the chat box. So those are just a few updates, and we'll have a few more at the end of our presenters. Slow down, Robert. Okay. So we are going to now jump into the health district, the Spokane Regional Health District. Before they come on, is Dr. Bob Lutz available with us this morning?
No, he emailed me that he's got sucked into another meeting. Nothing as important as us, but he had to do it.
Oh yeah, we love Bob, and we know he does his best to keep us informed. But we do have the Spokane Regional Health District available to us this morning to kind of give us an update on the COVID vaccine rollout for our specific population and community members who we serve. Is Kylie? Are you on the line?
I'm here. Hi, everybody.
I will give you the virtual stage, the virtual mic to give us some education.
Awesome. I'll try to be brief because I know we have a packed agenda. First, I'd like to start off by just introducing myself and giving you guys a little bit of background. So I am the homeless outreach coordinator at the health district. And before this role was created at the health district, I worked in the immunization program. And we kind of started our work at the health district with shelters and people experiencing homelessness during the hepatitis A outbreak. And so we are using a lot of the same models and strategies that we used in hepatitis A as we are now doing COVID-19 vaccines. And so I just kind of wanted to share that background, and that I'm really passionate about vaccines. And so very happy to chat a little bit about what we're doing at the health district right now with regards to the COVID vaccine. There is one big difference between the hepatitis A response and our now COVID-19 response. With hepatitis A, we were kind of at the forefront of that, offering vaccines, and we were one of the main players who were offering that in the shelters. That has changed now with the COVID vaccine, and we are just one of many who are responding and trying to spread vaccine out into the community and to start with our most vulnerable people. One of the priorities at the health district, though, is community members in the shelters who are experiencing homelessness, who are especially vulnerable. And so that we're a little bit more limited in our scope with COVID-19 vaccine. The vaccine that we get is from the Department of Health. And so we are held to the phases that the Department of Health has put out. I'm sure some of you guys have seen that, and I'm going to add the link right here that goes over the different phases. Right now, we're still vaccinating 1A, which is the high-risk healthcare workers and people in long-term residential facilities. And 1B is how we've been able to start vaccinating in the shelters. And so we are able to vaccinate community members that are 65 and older, or staff who are 65 and older, or staff who are 50 and older in a multi-generational household outside of their shelter work. And then community members who are living in the shelters who are over 50. And so that is, in some shelters, that's quite a big proportion of the clients there. Other ones, not so much, like a lot of our family shelters or youth shelters don't meet the current criteria for vaccinating. And I think there's a lot of confusion and just kind of frustration with these phases, but we're trying very hard to follow the guidance from the Department of Health. And I think something that's helpful to think of is that there will be enough vaccine for everybody eventually. We're just having to do a couple at a time, and we're slowly moving down that list of phases. So we will continue offering vaccines at the health district and throughout the phases. And I think we'll be really excited for tier 1B or 1B tier 4, which will include all of the people who are associated at the shelters. And so we started last week with our clinics. Our first week, we got 116 people vaccinated, and the second week, 59 people. So it's a total of 175 community members at the shelters decided to get vaccinated. And I was able to go to all of the clinics to kind of help with the rollout. And it was really exciting to see how many people were ready and willing to get the vaccine. I think we were a little bit concerned, like historically there's just a lot of distrust of the government and even healthcare providers. And I think this COVID vaccine is unique because it's so new. And we found that the large majority of people who qualified in this first phase wanted to get vaccinated and got vaccinated. We had a couple of people who got their first vaccine ever, which I think is pretty significant because it's 50 and older, or 65 and older, who got their first vaccines in the past 2 weeks. And so I think that was really gave me a lot of hope that I think the more people that we can get vaccinated, and it seems like a lot of people are really receptive, I think that'll really help start the turn of getting out of the outbreaks in the shelters.
Yeah,
And so
sounds like there's been some buy-in amongst the population, and maybe hopefully that continues. Are you able to give us kind of an idea of what the second, you may have been going into this, what the second dose looks like as far as accessing that and what that looks like?
yeah, so the only vaccine that we're offering is Moderna, and so that is 28 days later. And we are planning another set of clinics 28 days later in the shelters. And I think a lot of the providers were able to keep track of who got vaccinated. Shelter providers have been kicking butt on partnering with us. And I think some were even offering like to keep people's vaccination record cards at the shelter so that they knew where they wouldn't misplace them or lose track of when the next day or when the 28 days later is. And I think that will be really helpful. Shelter providers are a trusted resource for a lot of community members. And so I think that'll really help us to make sure that we find as many people as we can to get that second dose. We had a lot of success with hepatitis A, just finding people. With hepatitis A, it was 4 doses total with our outbreak schedule, and we had a lot of people complete that series. And so I'm hopeful we'll be able to get a lot of second doses. We're also there's just a lot of fluidity with community members and where they stay, and so we're hoping that with our clinics scheduled at all of the main low barrier shelters, that we'll be able to catch people even if they're not at the same shelter that we first got them vaccinated in.
Now, what if it exceeds 28 days? Like, what if they don't make it? Like, is it going to affect the vaccine process?
The guidance is pretty firmly on you don't want it to be before 28 days. There's not a lot of, like, because the vaccine is so new and it hasn't been studied for as long as other vaccines, that's best practices. With other vaccines, like it's like that minimum date of the 28 days or the 30 days later or whatever based on the vaccine. But the majority of other vaccines, it's never too late to finish the series. And so we're going to kind of follow that and just kind of know that it's hard. There's so many different, like, the vaccines aren't necessarily the first priority for community members who are experiencing homelessness. And so we'll just do our best to kind of support them in meeting that deadline as soon as we can. But if it's past that, we'll still vaccinate. If I have 1 more minute, I'd like to do just one last plug on the vaccines are just one of our strategies to support community members experiencing homelessness at the health district. We've been doing screenings and on-call testing and on-site testing at shelters since March. And so that was mainly fueled by volunteers and a couple of SRHG staff that we offered that 7 days a week. And so just recently in like November, we transitioned from symptom screening and testing of symptomatic people to surveillance testing and regular shelter testing, where we have rapid tests that are prioritized for community members experiencing homelessness and staff at shelters. So we're able to test people and get the results in 15 minutes. and test everybody who's interested and willing versus just people who are symptomatic. And so I think that's been super helpful, to give providers a little bit more of confidence in the testing that we're doing, and that we're able to respond pretty quickly when they have community members who are sick. And I think that's been pretty helpful. And then we also are doing site visits to do infection prevention recommendations and outbreak support we have a team of people who it includes our public health nurses, our case investigators, and epidemiologists who work specifically with sites who have outbreaks to manage that and try to keep it as small as possible. We've been having a handful of outbreaks across the shelter system, and I think we've had a lot of providers who have really done a wonderful job at trying to keep things low and protecting community members. It's hard when it's COVID's just across the community and lots of people are getting sick. So I think not having any significant outbreaks till September, the last September, is a huge, it's just a really big deal. And I think that's reflective of what great providers we have here, and all of you guys and everybody who's working to protect and serve community members experiencing homelessness.
Well, thank you, Kylie. It's much appreciated. Thank you for putting yourself out in the shelters too, doing all these testings. I remember seeing you all decked out in PPE and testing away. So thank you for doing that. And
thank you guys.
And that there was a question in the chat box: are you still isolating COVID positive clients trying to come into shelters?
Yeah, we have 2 isolation facilities that we are not having. It's very rare that we would have COVID positive clients stay at a shelter, only in instances where there's more positive people than negative people. But right now we have capacity at both isolation facilities, and we try to move them out pretty quick.
Yeah. Thank you, Kylie.
Thank you, guys.
All right, so we have a couple other updates real quick that we want to try to squeeze both of them in before 10 o'clock, just given the sensitivity to their schedules as well. But is Cal Koblenz, did I pronounce that right? Koblenz.
Perfect. Yeah, I'm right here.
Oh, nice. Cal, so you are, it sounds like the CEO of Spokane Valley Partners, and
Correct.
You are going to be providing us with an update today.
Yes. Thanks for the opportunity and the few minutes to speak here. It's an honor to be with you all. And, we're a beneficiary of all the work that you do. A lot of it trickles out to the Valley. So I know I haven't been involved in these meetings, but maybe that can change. But just a quick update on what's happening. If you're not familiar with us, Spokane Valley Partners, we're kind of the social services hub for the Valley. So we've been around about 30 years, and it's kind of a grassroots organization that started with the local churches back in the 50s and finally became a nonprofit in 1990. So we have the Valley Food Bank, which serves about 15,000 people in a year, unduplicated. We have the Regional Diaper Bank, which is serving 5 counties now. We also have a regional clothing bank. So all of our resources are targeted at the Valley area from Havana to State Line, but some of our programs do bleed over into other areas. We also have emergency assistance. We have payee services. So, and we partner with other agencies like Catholic Charities and SNAP, YWCA, that are all in our building to providing services that we don't provide, like housing assistance, domestic violence counseling, things like that. And so because we have kind of a captured audience of a lot of customers coming into our facility, then we partner with anybody who wants to connect their resources to our folks from the Valley that are coming for services. So if we have big serve days, which are happening throughout the week, windows of opportunity when we have lots of people here, that's a good time to come out, set up a table, and connect with people if you're interested. So that's always available. But kind of the COVID cares scenario here was a big deal for the Valley, for us. It gave us an opportunity. The city of Spokane Valley directed all of their food insecurity funding from the CARES funding that they received to us. And that was about $400,000. And what we were able to do is stand up a mobile food bank. So we now have a full service mobile distribution food bank that's operating not only in the city of Spokane Valley, but with additional help from the county with some of their CARES funding, about another almost 400,000. We're continuing that program throughout this year in outlying areas. So we're down in Freeman, Rockford, Fairfield, and then all of the other fringes of the eastern part of the county. So that gives us a great opportunity to show up in communities and neighborhoods where people have difficulty and their barriers. Maybe they have transportation barriers to get into a static location. So we just roll in with our trucks, and we have 3 trucks, 1 big refrigerated truck and a couple of smaller ones. But not only are we bringing food, we're in partnership with the Safeway program that's right now producing a lot of Safeway gift cards. So we've had probably $50,000-$60,000 worth of gift cards that we're pushing out into the community for Safeway groceries. We also roll in with our clothing bank. So we have racks of coats. We've given away hundreds and hundreds of coats. Our diaper bank distributes out of our trucks as well. So diapers, wipes, and baby essentials, along with things like pet food. And we can target specific things, like bundles of children's clothing and things like that. So we kind of roll in. It's like a carnival when we roll in and distribute. And it's just a beautiful thing. I love getting out to those sites and just seeing, moms roll up with 3 kids pile out of the car. They go out to the racks. They sort through the coats. They try them on. The tags are still on them. They're brand new. And they walk away just, with their trunk full and a lot of hope injected. So we're super excited about that. We do coordinate with Second Harvest and Salvation Army that have mobile programs as well. So all of our agencies are interconnected and working together. We also work with Meals on Wheels, helping get groceries into those vehicles that are going to those households. So we really want to collaborate and partner with folks. I see a lot of familiar faces and agencies and folks that we work with directly. Our big deal is distributing resources. So all those agencies are going deep, drilling deep, walking alongside people for long periods of time. We don't do that so much. We try to hit at the moment of crisis and provide what's needed, but we want to partner with the agencies that are going deeper so we can help them be successful. Yeah. Kind of like our diaper bank is, giving diapers to agencies that are working with individual clients. So that's the primary focus of that.
Yeah. Well, thank you so much, Cal, for giving us an update. I know sometimes the Valley gets overlooked as far as what services are available out there and how can people help. Barry posted the web link to the web page on there, and there are a few questions in the chat box. I wish I could ask with you online, but maybe if you could refer to the chat box and help answer those questions, maybe put your contact if people want to get engaged. Or I know one of our emphasis with the coalition is to get a lot of more church groups engaged. And we're going to be coming back to the Valley later on in this meeting and talking a little bit more about that. But potentially putting your contact information if those churches who are wanting to assist in the Valley, how they can get a hold of you and network that way.
Yeah, thank you. I did put my contact info in there. I saw the comment about the zoning. We're working on that right now with the mayor and the city council. And I can just tell you the attitude in the city of Spokane Valley is positive right now towards shelters. And they want to change, they want to do things the right way and get the zoning fixed so we're not having to kind of patch it together with a church solution, which we love our churches, But we want all options to be available without any restrictions. So,
Yeah.
so we're working on that.
Perfect. Thank you so much again, Cal.
All right. Thank you. I got to bug out.
All right. Okay, so that web link is in the chat box. If you're wanting to reach out to Cal, please do. I'm going to go ahead and give the virtual microphone over to Joseph Ader, or Joe Ader of Family Promise, to give us an update of kind of what's going on in the family shelter systems as of late. Joe?
Sure. Thanks for that, Rob. And Cal, love what they do out there at Spokane Valley Partners. We're actually trying to put a shelter in their building for families. We're running into that same zoning issue. So hopefully we can get that resolved and have that up and running, later this year, or next year sometime. Just to update on family shelters, our numbers were down through the end of last year at the family shelters. So we were having, 15 beds a night available, and Catholic Charities Family Warming Center was only housing between 4 and 15 people. So the city stopped the warming center as of January 30th. And so last weekend, the Family Warming Center at Catholic Charities closed. So all those families are at Family Promise. And so we're just about at capacity. I think we have just a couple of beds left right now. And then we'll be over capacity most likely in the next week or so. So that's what's going on there. And we are working on opening several new shelters. So we're working on opening up a family respite, which should come about in April, which is families exiting the hospital after a medical issue. We are working on opening an infant shelter, so families with newborns. And that one should open in April as well. We're just identifying the location right now. So we'll be on shaky ground right now. We're having a lot of the COVID babies are coming. So people took advantage of that quarantine time. And so we got babies coming. We've got 3 in the shelter right now, born in the past month. We've got 2 pregnant moms in the shelter right now. And we've had a couple more phone calls with pregnancies lately. So what we're expecting to see is this baby boom. And then the eviction moratorium running out at the end of March. And so we're expecting to see a lot of babies coming into the family homeless shelters in the next 6 months. And so we're actively trying to get ahead of that situation as best we can currently. And then the other thing is we are beginning construction on the lower level of the Family Promise Center, which will add 25 beds of capacity when it's completed. So by next winter, that will be open, the lower level at the Family Promise Center. So we'll double capacity in this next year from 60 to 120 family emergency beds. But it's going to be on shaky ground probably for the next 6 months with what that looks like. So there is some money being put towards hotel rooms from the city through Catholic Charities for overflow from us. And we have a meeting later on today to figure out what that process looks like. So hopefully we'll get an email out to you guys in the next couple of days with an update on what that looks like. So, all right.
And Joe, just real quick, if churches wanted to get engaged with Family Promise or even the family system, what would be the best way or best approach that they can help team up if they're feeling that calling?
Yeah, they could reach out to us, familypromiseofspokane.org. And we would love to connect with you. There's lots of different ways to engage, and those will be opening back up, as well as we will open up the church rotational shelter model by the end of the year. So that was put on pause because of COVID, and that will open back up. And so those unused church buildings can be used for shelter moving forward. So we're just in a slower period because of the COVID situation right now. And I'm sorry, I've got a meeting I got to jump off to, but love you guys. And I love all the work that everybody on here is doing all the time.
Awesome. Thank you so much, Joe. Okay, we got all of the before 10 o'clock presenters on their way through.
Hey, Robert, can I jump in right here?
Yep.
I'm not sure, but we may have someone from Catholic Charities who can talk about their warming center closed. That's the one out near Rising Strong, and what they're still doing some family support. And there was also something in the chat about St. Margaret's. I see Shannon, I think, mentioned that. So do we have some, like Shannon, can you mention what St. Margaret's does, and if you know about what Catholic Charities is doing in lieu of the on-site shelter?
Yeah, so I just wanted to mention, as we were talking about the family system, so I don't want to forget St. Margaret's is a part of the family shelter system. It's not a night-by-night shelter. It's a continuous day shelter for families. And you do have to come through coordinated entry. But it's a 19-room facility. Half of our rooms are slated for emergency shelter, which is 30 days with a potential for an extension. And then half of the rooms are transitional housing. So that's up to a 6-month stay. But yeah, our families come through there, and we have case management available, and folks work towards permanent housing out of there. So anyway, I just wanted to point that out, make sure that that's not off the radar. Yeah, so the family warming shelter was at the campus of Rising Strong. It was not, there was some confusion with the affiliation with Rising Strong, which was not accurate, just on the same campus.
And you had mentioned, in order to access the St. Margaret's shelter, they have to go through coordinated entry. What does that look like?
Okay. So, you know, our coordinated entry system, which we have for both singles and families, you know, SNAP does our singles coordinated assessment here in Spokane, and Catholic Charities does our homeless families coordinated assessment, which can be reached at 325-5005. And we are seeing families. So we're doing our appointments over the phone, but Monday through Thursday we have appointments, and we adhere to a diversion first model. So we will have a conversation with folks about diversion, and if they cannot be served through that, and they want to access these pieces of the homeless response system, like transitional housing, permanent supportive housing, permanent housing destinations like Pope Francis or Sisters Haven, those are options as well. Rapid rehousing. So, you know, if you want to, families want to access those pieces of our homeless response that come through coordinated entry, and they sit down with my staff, do an assessment, and referrals are put in for those different of our inventory.
Great. Thank you. And they looks like that the contact information for that coordinated entry was just put in the chat box by Barry. So thank you so much for giving us that information. That will be definitely beneficial. All right. So we're going to take a step back into the Valley world now that we kind of had a little bit of information given us to us from Cal, and then we had the family system kind of give us an update as well. We're going back into the Valley, and we are, looks like, getting an update from Kevin Lind. Kevin, are you on the line?
I am, yep.
Kevin, thanks for being with us. And it sounds like you're a pastor at Opportunity Presbyterian, and you are going to talk to us about kind of what's happening in the Valley as far as, and hopefully this meeting has been helpful as far as getting some resources for you, but your involvement with serving our community members.
Yeah, thanks for inviting me. And I have always had the Homeless Coalition on my calendar, but I've never been part of these meetings. mostly because it just doesn't fit into my schedule with getting kids to school very well. But I do, follow the emails and website and stuff, a little bit of what's going on. But as with lots of people in the Valley, I don't leave the Valley very much. And my focus can be kind of narrow to Spokane Valley. And so that's been the majority of my involvement has been in the Valley, and lots of organizations that are on this call we've worked with out in the Valley, and love doing that. So Opportunity Presbyterian Church is on Pines and Main, just north of Sprague, kind of at the middle of Spokane Valley, and has been for over 100 years. The church building is the third version of the church buildings that we've had over these last 100+ years. So in 2004, we dedicated a new building that has quite a bit of space, especially for a church of our size. We're about 200 member church, so we're not huge, but we do have a great space, and we see that as part of our ministry for the community. There are 3 community rooms that were built when the new building was built, and house lots of community meetings and groups. And we probably have, I think, 7 different 12-step groups that meet for various things throughout the week. And then I came to the church 7 years ago as pastor, and since then we've begun hosting the Greater Valley Support Network meetings, and we've also been the site for the Spokane Valley Homeless Connect event that's happened for 2 years now, that was modeled after the Downtown Connect. So we really value partnerships and working together as a community, for not only for our church, but trying to bring other churches into that as well. And so, I mean, we helped start Spokane Valley Partners Food Bank in the 1950s. We started the clothing bank in the 60s in our church basement that's now housed at Spokane Valley Partners. We're one of the churches that helped start Family Promise when it was Interfaith Hospitality in the 90s. We have a lunch site with Greater Spokane County Meals on Wheels that serves lunch every day, Monday through Friday, and has for about 20 years. And so all of these partnerships with organizations have been integral to what we do. We feel like nobody can do everything well on their own, and we just want to be part of what's already happening in our community and bringing people together. So that's the main gist of what we've kind of been involved with for a long time and continue to do so. In the current picture of things, like especially since the pandemic started and things shut down, we are operating all virtually still as a church, which is a new thing for us and something we're, struggling with. But the church is really about the people, and our people are very involved in lots of ways in serving our community, mainly through all these different partners that we have. And then in the 7 years I've been in Spokane Valley, I've been trying to build a network of churches in the Valley and bring pastors and church leaders together. And there really has not been a lot of that for a couple decades, I don't think. And so it's been a challenge. I feel like we're one of the few churches that have a long history in Spokane Valley. There are lots and lots of churches that are 10 years old or younger. And so trying to bring together lots of new people and new churches into the conversation about how to serve people in our city is still kind of in the beginning stages, but definitely want to be part of that. And we feel called as a church and as Christians to seek the welfare of our city and have a big heart for Spokane Valley.
Yeah. Thank you very much for participating. And as you're going through that development of getting other churches involved, I know the coalition leadership is definitely willing to provide any education that you feel like you need to help support that. So please reach out if you do need to. Please utilize us for that type of support. Now, thank you again for sharing with us, Kevin.
Yeah, thank you.
Yeah. And since we're on the topic of the Valley, is Sherry of the, let's see here, Sherry
Gangitano. Go Sherry.
Go Sherry. You have the mic for a couple minutes. What is there anything you would like to share with us in regards to the Valley or the support network you've established out there?
Okay, so yes, definitely would love to talk about it. So I was raised here in the Valley. I grew up and graduated from University High School when it was the old school. And I've raised my kids out here. And I've noticed that when you try to find resources, they send you to stuff in the city because there really isn't stuff out here, but then they send you the wrong ones. Either they're zip code restricted or like the rental assistance. SNAP was doing the county, but Catholic Charities was doing the city. And so we've been trying to form a group out here for a couple years. We didn't know what direction we wanted, but we realized that, you know, there's a void when it comes to a resource hub. And Spokane Valley Partners is awesome, but they don't necessarily, you know, the front desk isn't like a 211, you know, and usually, you know, I'm sure that they probably send people to 211 because that's where the resource list is. And they do an awesome job over there. But we want to be that 211 for the Valley. We want to be that resource hub. Anything east of Spokane up to Colbert, down to Micah and down. That's the first part. So we created Spokane Valley Community Advocates to do this. And we just launched January 5th. And so we're still going. The second part is advocacy, both teaching people how to do self-advocacy, because you've got to ask the right questions with the right words. Because case managers and social workers and intake workers, they're only going to provide you the information based on those questions. And if you don't ask the right question, you're not going to get the right answer. So we want to teach people how to ask for what they really need. And then the community advocacy, of course, like I'm doing right now. And then the last bit is providing hope and opportunity. And I'm sure you guys have seen on Facebook all the help groups. Somebody ends up COVID positive, they're now quarantined, I need help getting food, or I just started a job and I need black pants and black shoes, or you know, I need a bus pass because I'm out of inpatient treatment, but I need to get to my outpatient appointments and I don't have a way of getting a bus pass. So we want to be able to respond to those needs and have a network out here, whether it's community members, individuals, or whether it's businesses, or whether it's organizations, to where I can just put out a mass text or a mass email and get responses back, just like the Homeless Coalition does, but specifically for out here. We're on Facebook. I put my information in the chat, and I'm also the River Rock article in the Valley Current, which I'm super excited about.
Perfect. Thank you so much, Sherry, for sharing with us. And taking.
I did put an urgent need request in the chat. I also sent an email. It was a call that came in right as you were starting to talk at 9:30.
Perfect. All right. Thank you so much again, Sherry.
Mm-hmm.
All right. So we are now going to transition yet again. We are going to, is Matt Ryan with us?
Yeah,
Matt, can you please give us an update? I love
Alice, I
food,
need to get
and
off
I,
hold.
I imagine a whole bunch of other people love food too. But I hear that there is a Hunger Action Week coming up, and a Hunger Action Day as well. Can you kind of give us one updates from Northwest Harvest, but also kind of what that looks like?
absolutely. Yeah, good morning, everyone. So yeah, Hunger Action Week's coming up. We know that hunger and poverty have gotten worse over all these months, and we also are facing a state budget deficit. What that means is that this legislative session is going to be really, really important. And what we're asking folks to do is to attend Hunger Action Day, which is next week, Friday, February 12th. And what happens during this day is you get to meet with legislators and also other advocates about anti-hunger issues and about anti-poverty issues. So this is a time to tell the legislators how we feel, what bills we think need to be passed, and how we can support everyone. And the great news is that anyone can participate. You don't have to be really knowledgeable about this stuff. There's trainings throughout the week to get you prepared for Hunger Action Day, and those trainings will be recorded. So if you can't attend the trainings for the day, you can go back and look at them before the day to get prepared for that. I'm going to put the link to register into the chat. So if you go here, that's the perfect spot to register for the Hunger Action Day. And also want to briefly talk about Northwest Harvest legislative priorities. A couple of those this year include expanding the SNAP benefits, as well as increasing a lot of resources for food banks. We know that people are using food banks more and more, and we have to get more resources for those food banks, including things like refrigeration, freezer access, and access for mobile units. We're also looking at areas outside of food. It's very clear that hunger is a general poverty issue and that hunger plays into a lot of different areas. So we are going to advocate for things like the governor's housing priorities in the budget, as well as increasing healthcare access for people. One of the cool ones that you can read about, I'll put a link to the chat for our legislative agenda. One of those is to increase access for dental therapists, which greatly reduce dental costs for people who might not be able to afford normal dentistry. So reaching out to things outside of food that we think are really important. And again, that Hunger Action Day is Friday of next week, the 12th. So if you want to register, I'd say do that soon, and then a lot more information will come to you when you register. And anyone can do that. I just want to reiterate that. And please let me know if you have any questions. I'll also put my email in the chat. And I know didn't have a lot of time, so want to cut it off there and happy to answer any questions.
Thank you so much for that. And please, if there are any questions about Northwest Harvest in general, please direct those questions to the chat box, and I'm sure Matt will stick on with us and follow up with those questions. Thank you so much for joining us today, Matt, and sharing your time with us.
Thank you.
Awesome. All right, let's see here. We have Bridget. Is she on the line?
Yes.
Bridget, hey, how are you doing? It's good to see you again.
Good. How are you?
Not too bad. Well, now I'm hungry after talking to Matt. Was just wanted to chat with you about updates on Volunteers of America and the young adult shelter, and kind of an update and see how that process is going.
Well, not a lot of updates. The biggest one is we actually now finally have the contract to do the young adult shelter. It's sort of been it's been a difficult road so far. We do have essentially a couple of stages in the plan as far as moving towards a permanent location. So our plan is to start with two different interim locations. One of them is positively identified as Volunteers America's Hope House for those who are identifying as females. The other site is not identified yet for sure. We're looking at different potential sites. And so we would do that as interim, starting in sometime in April. And then we would move towards the permanent location, which we have some ideas around the permanent location. But again, nothing's been signed. No balls have dropped there. We're just kind of still in a sort of a searching mode. So I'd love to be able to give a more concrete update, but we don't have one yet.
Hey, anything is good. I think communication, and just so, I mean, we have 97 and at one point 100 participants. I think just kind of being in the know and understanding things are circulating, but it's just kind of taking its time.
Yes, it is.
Well, thank you so much for taking time to give us a little update, and hopefully next month we'll have something more concrete to share with everyone.
I would love that if we did. It's driving me a little bonkers myself. Yes.
Well, thank you so much, Bridget.
Okay, I gotta hop off myself.
Okay.
Thank you.
All right, so our last segment here is in regards, and this wasn't on the schedule that was sent out initially, but this is in regards to the point in time count. This information will be presented by Continuum of Care board member Dale Baris, who sits on the board with lived experience. But I just want to give kind of a brief overview, or not overview, of the point in time count, but there have been a lot of emails circulating in regards to the point in time count, specifically this year's approach and kind of what that looks like. As a result of those circulating emails, we had a kind of a collaborative meeting, one with the city and also with the city members with CHHS, Tim Sigler and Tisha Danzig, and also the leaders of the Continuum of Care board as well. So it definitely produced some good conversation about how we can do collectively a better job of informing you guys as far as changes that come up that you do need to be aware of as you are working the front lines. And with this information, Dale's going to go over last year's point in time count. But also, Tim sent out an email a few weeks ago about the 2021 point in time count that happened January 28th, and indicated that that information will be shared. It takes about a couple months to get it out, but hopefully we'll get this out sooner than what we're about to go over now. But there were some HUD guidelines that had to be followed in order to retrieve that information for this year's point in time count, which he did share via a link that, but the way it was communicated, we definitely, the three entities want to do a better job of communicating that out to everyone, because I know that there had been some expressed frustration with that approach. So we definitely understand that and hear your voices and want to do a better job moving forward. But right now, I'll hand it over to Dale. Oh, before actually handing it over to Dale, we did actually have a Continuum of Care main chair change up, as far as it was Pam Parr, but now it is Ben Stuckert. So he will be now sitting. Is Ben actually on the line? Well, Ben, if you are or are not on the line, I just wanted to give you a shout out. We're excited to have you a part of the Continuum of Care board and looking forward to that continued collaboration with you. He did send out some information to share with you guys as well, but I was hoping he could be on the line to share that himself. But I'll go ahead and hand it over to Dale to go over the 2020 point in time count overview. Dale, you got the mic, sir.
Thank you, Rob. Hi, everybody. Again, my name is Dale Brees, and I am on the COC board. I'm now the vice chair. I've been around the community for a while. and as a disability advocate and homeless advocate. This is just a quick synopsis of the big count from 2020 that happened in late January. And it's something that is mandated by HUD to receive the about $4 million that are awarded to our community, and that our community does compete against other jurisdictions across America for the homeless HUD money. It's a snapshot census of people experiencing certain categories of homelessness in the Spokane community on one night in January. And it was the 23rd last year, and that's for sheltered and unsheltered. Dozens of agencies participated throughout in the annual PIT, including social service and housing providers, healthcare providers, faith-based organizations, outreach professionals, and local governments. Additionally, community volunteers were trained and participated in activities, including helping with surveying in various service site locations, sorting and distributing donation items with targeted events for youth and veterans, and with the Regional Homeless Connect event. While the PIT count provides one way of estimating the numbers of individuals and families experiencing homelessness on a given night, it is not the only one. The City of Spokane's Homeless Management Information System provides a wide range of analytic reporting capabilities to help stakeholders, service providers, and leaders understand the extent and nature of homelessness in our region. How many people were counted? Last year, a total count of 1,559 persons, which make up 1,244 households, represent the total combined count for sheltered and unsheltered. 35%, 541 people identified as unsheltered, 65%, or 1,018 identified as sheltered, 79%, 799 individuals were in emergency shelters, and then the 21%, or 219 individuals, were in transitional housing. Gender of all the persons counted, 59% were male, 40% were female, and 1% were transgendered. Age of all persons counted, 15% were 17 and young, 17 were and younger, 9% were 18 to 24, and 76% were 25 and older. Household type, 90% were in households without children, 8% were in households with adults and children, and 2% were in households with only children. What was the geographic representation? North Idaho and Washington State, 89%, City of Spokane and Spokane County, 72, other Washington State, 10%, Idaho, 6%, other states, 12%. And so how does it compare, from 19 to 20? And I was sharing earlier that actually homelessness, the amount of it doubled in the decade of 2010 to 2020, the number of homeless in Spokane County. We went up from 1,309 to 1,559. Unsheltered, you see the difference from 315 to 541. Sheltered in emergency shelters went up 19. Transitional went up 5. You can see that type of households, 1% went from 89 to 90 with adults only, went 9% to 8% with adults and children, 2% with children only. Gender sort of mixed up, 60 went 1% down on male, 1% up on female. Transgendered was the 1% category, and then less than 1% for gender nonconforming. Age stayed pretty consistent for 17 and younger, 15% went up for the 18 to 24, probably because we were counting better with the youth initiative. And then 77% over 25 versus 76, so it went down. Race went down in the white population, up in the American Indian and Alaska Native, and then multiracial stayed consistent down. It went down 2% in Black or African American, and then stayed consistent Native American and Asian. What is not immediately apparent from this year's data and support by past PIT trend analysis and a myriad of other analysis and reporting products derived from the HMIS system, which is now actually called the CMIS CMIS, Central Management Information System, is that there is substantial racial inequity in who experiences homelessness throughout the region. For example, according to the last census, those identified as American Indian or Alaskan Native make up less than 2% of our Spokane County population, but yet make up over 12% of those identified as homeless. Similarly, those identified as Black or African American, also comprising less than 2% of the population, represent 77% of the homeless population in the recent PIT. So how's the data used? This data is used in concert with other data for the Homeless Crisis Response System and reported to the Spokane Regional Continuum of Care Board and to the Department of Housing to assist in planning and funding considerations. Along with the point PIT and longitudinal systems analysis report, also a HUD report provides a rich data set related to the overall usage of emergency shelters, transitional housing facilities, and other homeless housing programs. This report can help answer questions related to overall utilization of housing inventory, how people enter the homeless system, and the housing pathways that follow towards housing stability, and a great deal of demographic data on who makes up the region's homeless system. Yeah, there's, that's pretty, it's a synopsis of our 2020 report. And once again, our 2021 homeless count was last week and just for sheltered individuals. And so, that'll be a reflection, that'll look at reflective towards those numbers just presented. But we do see those racial disparities in the outreach versus general population. And so I think that's a critical aspect of how do we move forward to, decrease those numbers, but overall the low inventory of housing within Spokane. There's many things that right now are the pressures building. So, a lot of answers ahead, but a lot of great work by everybody and appreciate it. And as a continuum of care board member, realize those are numbers that HUD is looking at. There is numbers that we have discussed here potentially of how do we collect for the faith-based organizations data, because that's, how do we get centralized more and just improve on it towards the 5-year plan and working towards that. Thank you.
Thank you, Dale. And we definitely look forward to the 2021 count and that approach as well, as far as the restrictions that COVID played into that as well, and kind of how the numbers will look differently, but it won't necessarily affect the HUD funding that is received based on those numbers and based on those circumstances. There is going to be a list of shelters. So the methodology that was used was to count those staying within certain shelter systems. Specifically, I believe, well, we'll get the list as far as what those shelters look like and that were incorporated in the 2021 account, and post that when we have that information available. So stay tuned. But that basically wraps up this busy, packed Homeless Coalition meeting for this month, and we're looking forward to next month already as we go forward through 2021, looking for a better year and outcomes than last year. But we are excited and so grateful that everyone could participate. If you are still on the line, we leave this last segment for anyone who wants to make announcements in regards to system or organizational changes or resources you think may benefit those who are online. And this is recorded and will be posted on the Coalition website. And I'll let Barry take it over from here. And Barry, thank you so much. And Dale, for your time as well.
Thank you, Robert. Very much.
Thank you all for being here. If you have announcements or information or questions that you need answered, just unmute yourself. I'll recognize you and you can have the floor for a bit.
Hey, Barry, it's Seth, Community Court. Can I just make a quick announcement? Just want to let everyone know again, February 15th, President's Day, Community Court will be closed. And other than that, we are back open up Mondays, the first and third Monday of each month. We'll be at the Martin Luther King Jr. Community Center in the East Central neighborhood. The second and fourth Monday of each month will be at the Northeast Community Center up in the Northeast neighborhood. And then, of course, every Tuesday we'll be at the City Hall Council Chambers, and all those courts start at 9 a.m.
Thanks, Seth. Who's next? Oh, Virginia Methin. I see your hand up. Virginia?
Thank you, Barry. My name's Virginia Matheny. I'm a parent mentor, navigator with the Healthy Kids Together program through Better Health Together. And we are a partial community health worker and navigator, so we connect to resources and insurance within the Washington Health Plan Finder. And right now there's been a special enrollment period that will be opening up February 15th to May 15th for those without insurance. And then if anybody wants to reach out to us for a flyer or for us to do a presentation or to collaborate with your organizations, feel free to reach out to us. I've put the phone number and our outreach specialist name in the chat, but just really quickly, you can reach out to Eddie at betterhealthtogether.org or call us at 509-340-9008. And thank you.
Thanks, Virginia. I will capture the chat and post it on our website in a day or two. The recording will also be on our website whenever our tech elves get it up there. And the point in time count summary, which Dale went through, is already posted on our website and on our Facebook page. So who else has something to announce or mention?
Hi, Barry. This is Allie from Mission Community Outreach Center.
Hey, Allie.
I just wanted to remind everyone that although we're not open to let people come inside and go shopping, we can still provide people with clothing, hygiene items, diapers, and small houseware items. So we are working on a PDF fillable form right now that we'll be able to probably email out. My goal is tomorrow or maybe Monday to the Homeless Coalition, as well as putting it on our website so that people can fill out the form, email it back to us, and sort of hopefully streamline our program here until we're allowed to let people back inside. So keep your eyes out for that form that'll be going out. But in the meantime, if you guys have clients that need things, I will put our email in the chat box, and you guys can just have them email us, or if it's easier for you to email over what they need, we can definitely get them those items.
Allie, do you have zip code or area limitations, or are you open to anyone?
We are open to anyone. So you don't have to live in any specific area. So yeah, we'll be helping out everybody. So please let your guys' clients know, or just email us and we can definitely help them out.
Yeah, they're located on Mission near Napa, just so you know the general area. But that's why I asked you that question, Allie, because I know you are not limited. You help anybody. Thanks.
We do, yes. Thank you.
Who's next? No, no more announcements, no more questions for the group. Then I might do what Robert does sometimes at the beginning. Do we have any shout outs? Do we have anything like, wow, thank you so-and-so, thank you for this? I'm mostly thinking of is like, where would we connect it? Like, thank you so-and-so with connecting, because that's what I think this coalition is really good at, helping groups connect. Anything where you've seen that work well, or?
This is MJ with PCAP.
MJ?
And I just want to say thank you so much to Allie with Mission Community Outreach. She has come through for me so many times. I'm just absolutely blown away. So thank you.
Yeah, I second that. Mission Community is a good place. Who else?
I was going to say the same thing. That urgent need I put into the chat. The Allie's group stepped up, and we've got some of that already taken care of, and it didn't even take an hour. So that's awesome. And we've already got her a couch, and I've got requests put out for dressers and twin beds and tires, so she can get her car up and running again.
Thank you, Sherry.
So, thank you.
Angela, do you have your hand up? Go.
I just want to give a shout out to Jules Helping Hands and City Church. And I was over there this weekend at that shelter. It was impressed. It's just so warm in there. I loved it. So good job. Thank you.
Julie, can you talk about what you're doing? You've always got stuff going on. And mention the Valley too. Talk about the Valley.
I am looking and working with churches in the Valley, trying to come up with a space for a temporary warming center, 2 to 3 month space. We have the warming center over on Madison, 3816 North Madison. That serves 30 to 35 folks per night, where it's low barrier, so anyone in any condition can come. We do have stricter rules than usual Jules warming centers, simply for the fact that we're in the Garland district. We've also been able to, because of COVID, make our rules a little more strict so that folks aren't hopping from shelter to shelter. So we have about 20 guests that stay and have stayed since the beginning, and we have about 10 rotating beds. We also have 3 respite beds. If anyone's needing those, they go through Robert at the Providence Free Clinic. They can help you get those beds available to you. Mobile showers are still running 6 days a week, depending on the weather. If it is snowing, we don't do showers that day. Mobile food bank and clothing bank is still up and running. And we are looking for underwear. Every size for everyone. We are going through an enormous amount of underwear. With every place being closed right now, I think we're clothing about half of the city, and we go through about 150 pairs a week. So new or used, we will take them. Oh, and we have a new building coming open in the Valley. We're hoping to have it open by the end of February. Our new location will be directly across from Numerica on Sprague. In the back building of the Panda Express parking lot, it was an old car wash. It will soon be renovated into a building, and it will provide laundry services as well as clothing and hygiene for people experiencing homelessness.
Gee, is that all, Julie? Thank you. Who else?
Well, I'm here too.
Yeah. Who else? Tell us what's going on.
Is it okay if I talk real quick?
Of course, Madison. You can talk real slow even.
Thanks. So I'm Madison. I'm new here. I'm a senior at Eastern Washington right now, and I'm trying to come up with a furniture home goods sharing kind of bank. I've definitely seen a lot of emails of that being a need in the area, and I'd like to make it possible so that I can connect with a lot of different organizations and just really handle all the inventory management so that when people are placed into stable housing, that they can get the furniture that they need. So I'm still in the development stage. If anyone has anything that they want to share with me about that, that would be really helpful. I do have my name and email in here, but I can put it in again while I'm still trying to get that started. So yeah, I think that's mostly that.
Thanks, Madison. Yeah, put it in again, because if it's said in the beginning, people are like, where is it? Where is it? Where is it?
Cool, thank you.
Who's next? Well, I'm just going to start calling on people and ask you to tell us what you do, because every single one of you, I think, has an interesting story. Who do I want to pick on? Oh, now you're going away. Rob Stevens, tell me who you are and what you do.
As soon as I can find the mute button.
You found it.
Hi, I'm Rob Stevens. I'm one of the community connectors with Molina here in Spokane. So I work with not only the Medicaid and Medicare and Marketplace populations and help them find access to resources to fill the gaps and needs that they run into. So, and then if it's something more intense, we'll push them up the ladder a little bit higher to case management. But yeah, a lot of times they can just come to me and, I need help getting access to this, that, or the other. And I spend a couple of days doing the research and give them back some resources they can reach out to. So
Good. Thank you, Rob. Sarah McNew, who are you? What do you do?
Hi, everyone. Thank you. Very nice to meet you. I see your emails come through all the time, and this is my first meeting, and I'm happy to connect and see how many people are here and involved. Sarah McNew, social worker. I am the coalition coordinator for West Spokane Wellness Partnership, and we are a community coalition with 2 different grants, and our fiscal representative is New ESD 101. But basically, we come together, different sectors of the community, and we come together and really focus on overall community health and wellness as it relates back to substance use prevention. So we do a lot of work with the West Central Community Center, North Central, Glover, and then families within the West Central community. And we pretty much we are a jack of all trades. We have our hand in a lot of different things. We provide prevention curriculums that are evidence-based and innovative at several organizations with youth and families. We provide free medication lock boxes to organizations or individuals within West Spokane. We provide different training opportunities from trauma-informed trainings to naloxone trainings to drugs of abuse trainings. We have a lot of those coming up. Basically, we just try to enhance the strengths that are already happening in the community and also alleviate gaps where we can. So anyways, thank you for letting me take the opportunity to introduce myself and some of our upcoming projects we're developing a youth coalition that's focused on youth leadership and youth prevention, and then also an Indigenous youth prevention coalition as well. So I'll be distributing those flyers shortly. I'll get those over to you, Barry, as well. But again, thank you all so much, and I'll put my email in the chat along with our website.
Good. Thank you, Sarah. Sounds like you see a need and you try to respond.
Yes, exactly.
Good. Hey, Joe Sams, how about you? Tell us what you do.
Good morning, Barry. How you been?
Good.
I work for a company that tries to stay invested in the community, and so as a community supporter, I just try to educate myself on everything that everybody else is doing, and then try to transfer that knowledge and help out educate my circle of influence. And so I appreciate everything everybody's doing, and look forward to, I think this is about the time of year I've had lunch and learns in our office. And since we're doing Zoom meetings, I'm trying to figure out how to do a possible Zoom lunch and learn.
Mm-hmm.
Thanks.
Yeah, we're all learning now, new stuff. Zoe from SNAP, tell us what you do at SNAP. Maybe Zoe is getting a cup of coffee right now.
Oh, hello. Hi,
Zoe.
Sorry.
Oh, Zoe.
What's new and exciting in the world of SNAP? Oh,
Yeah.
Not much. Just hanging out, you know.
Yeah.
No, I'm a housing specialist with SNAP. I work mainly with youth and young adults. And so that's kind of where I'm at, just helping them, you know, get into housing. Housing is very few and far between, as you all know. But luckily I don't have very many folks on my caseload right now, so it's not too bad. But other than that, nothing too exciting, report worthy.
Okay. Let me ask you this. Am I correct that some of the folks that you see are like kids aging out of foster care, and you try to help them? Is that something you do?
It is something that we do, but in my experience so far, I haven't come across too many of those. Okay. Unfortunately, a lot of them have been homeless though before they were 18. You know, they were aging out of crosswalk. You know, that's a common one. Mm-hmm. Yeah, it seems like they didn't just become homeless. You know, that seems like it's been a pattern for most of them, unfortunately.
Yeah. Okay, thank you.
Mm-hmm.
Hey, Mark Ward, are you here? Can you tell us what you do?
I am here. I am the landlord liaison for Goodwill with the HEN program as well as the SSBF program. Ironically enough, when you said connecting people, Barry, it is your homeless coalition list that I kind of basically utilize to share resources or to like tell people if they need anything to go access your list, because why create, you know, a new wheel, so to speak. It works really well as it is. Yeah, I guess I'm chairing the landlord liaison network, I guess is what it's called. It's kind of a goofy deal, but basically it's landlord liaisons and people that mostly work with housing directly, that have like landlord issues. Through the continuing care, we kind of meet separately and just try to go over different housing related stuff. Barry comes to the meeting. I know MJ does. Robert, who just talked. Yeah, so ironically enough, I actually emailed MJ and Robert this week about rental assistance stuff they were wondering about. And then I think that's it, Barry. I don't know, unless you can think of anything else you want me to talk about directly.
No, that's great. And if anybody wants to make an announcement, just unmute and chime in. Otherwise, I'm going to say, Amanda Boyer, who are you? What do you do?
Hi, my name's Amanda Boyer. I work with SNAP. I actually do the Spokane County outreach. So I work in the Valley and grab those that are homeless and hopefully get them engaged into services.
Good. So we were focused on the Valley today. Did you hear?
Yeah.
Do you want anything you want to add about the Valley from your perspective?
No, I don't want to add anything. But yeah, I'm glad that that was the focus today. I got a lot of good resources, and I'm going to be reaching out to Sherry and hopefully getting engaged with her.
Good. Thank you. Since we're on a SNAP tear here, how about Candy from SNAP? You there, Candy? Well, maybe Candy's out getting some coffee. How about Rick Wallace? What do you do?
Hi, I'm one of the public defenders assigned to community court, and I have not attended one of the Homeless Coalition meetings, so I wanted to get on board with that.
Okay. Is there anything we could do to support your work? Because what you've got here, I mean, we're down to only like 20 people right now, but we have a listserv that goes out to 1,200 people. And at the height of our Zoom meetings, there's 100. Is there, and most of these folks have, I think as you're getting the sense, just have some connection with homelessness in either agencies or churches, or is there something that would be helpful for us to know about what you do in community court?
At the moment, I can't think of anything. I've been involved with the community court for about 2.5 years. Francis Ottawali is usually on here. Seth, our coordinator, is on here, and then Jennifer Pence is usually here as well. So we usually get pretty good feedback and have good connections with folks, but I just haven't been on here. So I wanted to do that. Thank you.
Okay, well, welcome. Glad to have you here. Let's see, how about Scott? Can you tell us who you are and what you're doing? Scott, fumbling for the mute button, or maybe is out getting a cup of coffee. How about Alyssa Marticelli? Alyssa Marticelli.
Hi there. My name's Alyssa. I'm a senior at Eastern in the social work program. I'm currently interning at DCYF, and we're all virtual right now. Department of Children, Youth, and Families. I'm completely virtual, so I've been trying to find more ways to get like hours in and everything, and my AFI recommended the Homeless Coalition to me, so this is my first meeting, so super great to find out all the resources around here. I'm currently working on a project with a couple of other students to put together like a list of resources for foster families in Region 1 of DCYF, which is pretty big region, goes all the way up like to the Canadian border, and just because a lot of it is rural. So I can always add my email in there also if anyone has good resources for foster families in the area. But yeah, thanks for having me.
We need so many foster families.
Definitely. Yes.
Yeah, thank you. Thanks for being here. Let's see. I see Robert Martin, and I think I'm seeing double. I see the name Robert Martin on here twice. Do you want to tell us who you are? No, maybe not. Christina Vanessa, how about you?
Hi, I'm Christina from Vanessa Behan. I'd put my video on, but I'm in my robe, so. So yeah, I work at Vanessa Behan. I'm the Family Service Program Coordinator there. And so I oversee the intake department. And so we see a lot of families who, you know, they leave their kids with us while they're working on whatever they need to do. We do see homeless families, so I like to come to these meetings. I'm often reaching out to Joe from Family Promise to see if they've got space and other places where we can direct our families who are homeless, and while we, you know, we can keep their kids or helping them with resources. So we do refer to a lot of you guys, SNAP, and just a lot of different places. So I love this monthly meeting and being able to you know, hear of new resources and things that are happening in the Spokane world here, so in our local community.
You have a new building coming, don't you?
Well, we've already moved into our new building.
Oh, you're in it.
Yeah. Yep. So it's on East Sprague.
Mhm.
It's right next to Frontier Behavioral Health.
Mhm.
And yeah, so we've been in there just over a year.
Oh, okay.
Oh, that's
I missed that
no,
one.
that's okay. And yeah, so our hope is to one day be able to have up to 60 kids. Right now, our capacity is 20 to 24. So
Is that because of COVID?
no, it's just because we are privately funded and it's just funding and staffing.
Oh,
So yeah,
okay.
we're slowly working our way up, but
Okay.
so
Then there's very a small number here, but I'd suggest if you come on next time, come in, get my attention around 9:20 or 9:25, and I will let you mention that Vanessa being how many you could take, but how many you're limited to by funding. Let's put that out there and see if there's somebody on this Zoom who will say, whoa, I can help with that.
yeah, that's great. Okay, thanks. I'll come. I usually try and come early, but I wasn't able to today.
Okay.
But I
And
do
yet
like
this-
that
And
network.
just put you in the, like, put hi Barry, this is Christina from Vanessa Bean. I'd like to make an announcement, and or either do that right sort of before we start around 9:20ish, or right when we're done. If I don't call and put that in there, so I would like to get that out there in the world.
Great, thanks. I'll do that next time.
Okay, thank you. Well, I think I've called on everybody on the screen. Anybody wants to talk to me, fine. Otherwise, I'll probably end this and eat my oatmeal and go off to my next thing. Okay, I think I'll go off to my next thing. Thank you all for being here, for what you're doing. Bye-bye. Yep, bye, Dale.
Bye, Barry. Thank you.
Mhm.